So, I'm coming to you from the other island, on the other side of the country. I joke with my colleague here that, the best two places are on either side, balancing each other out, and there's just a big, whatever in between. Um, so, I'm from the Intercultural Association of Greater Victoria. So in Victoria, we serve about 14 municipalities and some unincorporated areas like the Southern Gulf Islands and the Souk foothills and potholes, that area. And we're also part of an alliance on Vancouver Island of immigrant welcome centers. So there's centers in Victoria, we're in Victoria. There's one in Duncan in the Cowichan Valley. There's one in central Vancouver Island in Nanaimo that serves Parksville and the surrounding areas. And then there's the Welcome Center of northern Vancouver Island, which serves Courtenay, Comox, Campbell River on north into the communities of Alert Bay and Soin. Have many of the issues that have been talked about here. So places like Sointula, for example, internet connections are pretty dicey, low, it's not high speed. There's other problems related to that, so very hard to provide some of the online services that we've talked about. Getting there involves a plane, possibly a float plane, but more usually a long drive on a not very good highway to a ferry that runs very infrequently and, does the milk run around various islands, and coming back does the milk run around various islands. So a huge variety, compared with Victoria, where there's 375,000 people in our area, and we've got lots of provisions, including 2 hospitals, full hospitals with all the various services, and 2 universities. There's 3 universities on the island. There's 2 colleges on the island. One is in Victoria. One serves northern Vancouver Island. So it's a real mix of what we're serving. And we were in meetings on just Tuesday this week, talking about some of the successes and challenges around the arrival of primarily Syrian refugees in the communities. So just to give you a sense of who's arrived and in what categories they've arrived. For government-assisted refugees, we've had about we're now up to about 180 who have come into Victoria, 154 in the first batch that came in at the end of February, beginning of March. And we're expecting about 140 more. We also had a few GAR families go directly into Nanaimo through a hub and spoke system that we've worked out with Immigrant Services Society of BC. For privately sponsored refugees, there's 2, we're a sponsorship agreement holder, the Intercultural Association, a very new one, and then the Anglican Diocese of British Columbia, which serves Vancouver Island, the same big region, is also a local sponsorship agreement holder. And then, of course, there's national agreement holders that, like the Mennonites, for example. So there's some sponsored refugees going in addition to what we've done. So to date, between the Anglican Diocese and ourselves, we've had 160 private sponsored refugees come in. And we've had 93 blended visa officer referred refugees come in. I think that's important. The blended visa officer referred refugees are interesting because instead of flowing through the government-assisted stream where there's an expectation of the kinds of challenges they might have, they're going into very remote communities sometimes, and sometimes with very high medical needs, for example, or disabilities that are not easily served in some of the outlying communities. Remember, I said 2 big hospitals in Victoria, south of the island. There's a couple of small hospitals further up island, but not prepared to handle, for example, someone with terminal cancer. That has to be done in Victoria, and yet the family's in Nanaimo. So, there's those kinds of challenges that have come up. And we are expecting, before the end of the year, probably about another 200, about 140 GARs, and then there's probably another 150 or so privately sponsored refugees who are, you know, in the moving. We're not exactly sure when, but anyway. So I wanted to talk about, well, we have also a variety of situations. So in Victoria, we have, in terms of finding rental accommodation, there are 3-year wait lists for public housing, and our rental vacancy rate is 0.6%, so extremely low. Up Island, even in Duncan, the situation changes. So there's more public housing available, and the rental, both the rates and the vacancy is, there's much more opportunity in those places. However, on the employment side, our unemployment rate is much lower in Victoria than it is in the other places up Island. So we sort of have a mix of some things are good in some places and some things are better in other places. I wanted to talk about a few of those pieces. One of them, we talked about transportation, that's come up. So in Victoria, we were in the happy situation where, first of all, we have a reasonable, if not fantastic, public transit system. And the Transit Commission for our area decided that they would give free monthly bus passes for 1 year from the date of arrival for all the refugees who came in 2016. So that's great, and we didn't even have to ask them. They decided on their own. However, if you live anywhere outside of that transit area, that is not the case. Plus, there's not really much of a transit system. So in Duncan, which is only 45 minutes away from us, for people to get to English classes, there is no public transit, and it's very difficult. And really, besides Nanaimo, any places north, it's very challenging in terms of people getting into English classes, even though there may be spaces in English classes. In Victoria, we have a wait list for our LINK class. Before any Syrians arrived, we had a wait list of over 400 people. For our LINK classes, we're the sole provider. We got a few more classes in. We are now down to all the Syrians, unless there's a child care need, are in classes. And we have finally, after February, been able to bring in some immigrants who have been on the wait list waiting for, so the refugees have come in, and now the other immigrants are being able to slowly come into classes. Not maybe the best situation for social cohesion, but that's where we are. In places like Nanaimo and in the Cowichan Valley, there's no wait lists for LINK classes. In the North Island, there are no LINK classes to be waiting for. So there's, again, a really broad range of what's available for people. Again, in the South Island in Nanaimo, which is sort of a medium-sized community, we have the Settlement Workers in Schools program. So the transition for the refugee children coming into the schools has really been relatively easy, and the schools have been prepared, and as soon as they knew people were coming, were chomping at the bit to get training and understanding and figure out how they were going to do this the best way possible. The school districts, we deal with 3 school districts in the Victoria area, and they came together for the first time and did a joint orientation for the refugees who were housed in temporary accommodation to the school system, including tours to the various, elementary schools, middle schools, high schools. So very, very helpful and very cooperative. And the feedback we've gotten from the schools once the students are in there is, we want more refugee kids. This is great for our school. It's been a really good experience. Obviously all the challenges are there, of course, because we've got children going into school who have been out of formal education for some time, so they're academically behind their age group, and they're learning English. Well, many of them quite quickly, but they're still learning English, so it's a big challenge. But nonetheless, the school's been great. In Duncan, as I said, 45 minutes north, the school district was saying, well, we don't have funding for these kids. So there they were in the spring, and they weren't getting into classes until the budgets went in, ready for the school year in the fall. Now, there's nothing right about that, but that's the situation that came up. So there's those kinds of variations that we've been dealing with. And because many of the refugees, particularly the GARs and some of the blended visa officer referred, the BVORs, also have disability challenges and other issues. So we've got, for example, a child with Down syndrome who the school isn't accepting in because they don't have the funding to accept someone with that particular, I know, and it's like, you go, what? That doesn't make any sense. They have to do that. Of course they have to take them in, but they didn't. So, we're working through those kinds of problems, and part of it has to do with familiarity and readiness to receive, and so, we're working through those kinds of challenges. What else do I want to say? I want to talk about some of the things that worked really well. So in Victoria, we were able to take very quick advantage of some work we've been building on over the past approximately 7 years. About that time, the provincial government of British Columbia had control over settlement funding at that time. And so with federal money, they started a program called Welcoming and Inclusive Communities and Workplaces, WIC-WIP. It's a nice acronym. But it was a very clever program and very well funded, where we were able in community to do needs assessment and talk to stakeholders about what do we need to do in this community to help ourselves be more welcoming as communities and more welcoming as workplaces. And out of that, we built a number of projects, some related to education, some related to research, some related to implementation of pilot programs and other things. And we built what we call the Community Partnership Network, which in Greater Victoria includes over 200 organizations. So they are municipal governments, school districts, the universities, college, employers, funders like the Community Foundation and the United Way, and then service providers of many stripes, and some private sector organizations who really have made a commitment to try and be more welcoming, both in terms of how they run their organizations and in terms of how they respond to prospective customers or clients coming in through their doors. And when we knew we had refugees coming, it was very easy to pick up the phone and say, I think we're going to need your help on this, and can we come together? And so we've had a very strong and positive response from the community, including funding being freed up from both the Community Foundation and the United Way in order to support some of the activities going on. So that's been a very, very positive thing. Now, we do have a LIPS, but for those of you familiar with LIPS, you know that their mandate is more restricted than sort of broad community development. It's more around planning and that sort of area. So the Community Partnership Network for us was absolutely invaluable. And because we've been working with these groups for 5 or 6 or 7 years, we knew each other. So it was very easy to pick up the phone and know exactly who to talk to about the different areas. So we didn't have to do a lot of poking and prodding. So that's been very, very helpful. The other challenge that we faced in our community, and I know this is echoed for other communities, is there was an enormous outpouring of people wanting to help, to donate money, to donate things, to volunteer, to get involved as sponsors, all wonderful, except when you're an organization like ours, which generally pulls in maybe $50,000 a year in charitable donations, and suddenly we're dealing with over $1 million in charitable donations for sponsorship and things. It takes time and work. So on our side, bringing ourselves up to be able to have the internal capacity in the organization to do that was very challenging. It has been very challenging to manage the expectations of the community. We started to internally joke about everybody wants to touch a Syrian, which is not really very funny, but it is, it was very true. We'd have people say, well, I donated. When are the first people coming in? I want to meet them at the airport. It's like, no, that's not going to be the way it works. But we really had that kind of energy, and so we've really had to work very hard to talk to people about respecting people's privacy and understand that when people arrive, they're tired, and be patient. And you can help in many ways going to and everybody doesn't need to go to the airport to greet people, that sort of thing. Donations of things. Now, we've had experience of this in the past where people are moved. They see people are going to need things. And sadly, for some people, that means that mattress that's in the basement that's been sitting down there for 10 years that my child grew out of now, a refugee would like that. So we'll bring it down to your office. It's like, well, yeah, no, we don't do that. We're not in the business of warehousing donations or vetting donations to see if they're appropriate. So we, in that case, partnered with an organization which is a secular organization that gathers goods and resells them in a thrift shop kind of environment called Women in Need. This one, I think, just exists in Victoria, but it was a very good partnership. So when people called with those kinds of things, we could direct them to Women in Need, and Women in Need, in turn, provided refugees with a voucher that said, so they could go into the stores and choose from themselves. And everything we know about receiving refugees, when people have had so much of their lives or their ability to make their own choices about what's happening in their lives, giving them opportunity to make choices for themselves, even in small ways, is very helpful in terms of rebuilding their self-esteem and sense of personal agency. So we've been able to try, and we've really tried to steer as much as we can those outpourings of generosity into things that don't feel like people are just, on the receiving end of all this giving, because that's also can be a very uncomfortable piece. We've also had to manage the expectations of the refugees themselves coming in. People came in with very interesting ideas about what was going to happen when they got here. We did have people from IRCC come and do some focus groups with some of our clients, and they came out of it and said, they said to us that the Canadian government promised to find us housing, to find us work, to find us schooling, to give us, so there's this sort of long list. And, the people sitting in this room know that that's not quite how it works. You'll get help finding work, but no one's going to give you a job. You'll get help finding housing, but you have to take, some agency and some responsibility in that role. So that has been a challenging one, and with a very connected group of, population where everyone's talking to each other on social media and comparing notes about what happens in Quebec versus what happens in BC versus what happens in Ontario, we've had to, I guess, do crash courses in provincial, federal responsibilities and that kind of thing, municipal responsibilities. The other thing that has been going on and that we've been trying to work with and keep up to as much as we can is around media. There's been tremendous media attention on this, tremendous. We went through a period where in a week we would have no less than 6 to 10 media calls. And that went on for surprisingly long. And I would say the media has been remarkably positive about these stories. I think that many of the journalists were very pleased to feel that they were part, like many Canadians, of doing something good. It's been a very positive, but it takes a lot of time. And again, a lot of the messaging out there was around, please don't drop your, old furniture off at our office. Here's another way to do it. Or if you'd like to give, this is a good way to give. So I want to just sort of, I'll just talk about a couple of really, or another really good collaboration that happened because of the relationships we'd built up in the community. And that's with Vancouver Island Health. So this is the health authority in our region. And they got right on to coming to the hotel, the temporary accommodation where we had the big group of government-assisted refugees, and doing all manner of screening for people, connecting people to family doctors, which in Victoria, I'm suspecting it's the same in Newfoundland. Having your own family doctor is pretty challenging. Most people anybody new coming into the community, regardless where they come from, that's like a long-term project. That's not something that happens quickly. We were able to get the refugees attached to family doctors, which was quite a feat. We could never have done that on our own. That was the health authority doing that work. They also, since the first group has moved through and they're in permanent housing, they have set up medical clinics at our offices. So they come into 2 half-days a week and do screening and follow up with nurse practitioners. So that is hugely helpful, and hugely helpful in terms of taking time or giving time back to our workers who would otherwise be accompanying people to medical appointments and other places. So that's been a really hugely helpful piece. So I guess the big push right now, and I'll wrap up on this, and I think this is happening across the country, is around employment. I've started to now be fielding calls from the province fairly regularly. How many of those refugees are employed? Well, to date, our count is 1 refugee with 1 half-time position. He's a privately sponsored refugee who happens to be a mechanic who has got a job with a Arabic-speaking mechanic shop. So we are in this place where part of the education we have to do, and part of the reality check, is that people will not be getting jobs. Even though there's lots of jobs in our community, they need to have a level of English which they have not, most of them have not accomplished yet in order to get there. So that's one of the big challenges we have before us in the next little while. And I'll stop there. Thank you.